We are going to go on to our next session, which is Women's Health and Leadership. This panel explores the crucial link between women's health and leadership, hence the title, examining how systematic barriers impact opportunities, well-being and representation. We're going to be discussing the role of policy, workplace culture and society attitudes in shaping women's access to leadership and holistic well-being through an intersectional lens. We are joined by Reena Sidhu, Health Innovation, WM, who we're sharing this panel alongside Mari-Carmen, Sanchez-Morris, founder of the FitMAMA Way app, Kumbi, Kariwo, Health Inequalities leader at Birmingham Community Healthcare NHS Foundation Trust, Nisha, Digital Innovation Nurse Specialist, and Terri, founder of CEO of Talks with MS. Thank you.
Hello, can everyone hear me? Yes, perfect. So hi everyone and good afternoon. So my name is Reena Sidhu and I'm honoured to be hosting this vital conversation around women's health and leadership, empowering change and driving equity. So women's health and leadership are deeply connected, yet systematic barriers continue to impact opportunities, well-being and representation, from workplace culture to policy, social attitudes. Many factors shape women's access to leadership and holistic well-being. So today, through an intersectional lens, we'll explore how these challenges play out and, more importantly, what we can do to foster environments where all women can lead, thrive and influence change. That said, I'm going to hand over to each of my lovely panels here today and do an introduction and a little bit more about themselves and also about their work and what brings them to the discussion today. So.
Hello, so my name is Kumbi. As introduced, I'm a learning disability nurse by background and current health inequalities lead in the NHS. And I'm also a co-founder and director of a community interest company called Everybody Outdoors. And what we do is we work with brands in getting technical gear for people that are plus size, because up until 2021, if you're above a size 16, apparently you didn't do outdoors. So we're trying to change that narrative.
I'm Nisha and I am a digital innovation nurse specialist. Background nursing in emergency medicine and community healthcare, but I've got a bit of a passion around data analytics and implementing real life solutions. So things that are not only going to help our population, but also help our workforce as well. And one of the work streams that I'm looking at pushing for the next financial year is around women's health and what we can do from a proactive element as opposed to a reactive, which is what we're currently stuck in the cycle of.
My name's Mari-Carmen. I'm a nurse by background and I have a health business that supports women, but also businesses, particularly those women that are returning back to work after having children, but retaining them. I have come to do what I do, really experiencing firsthand the lack of support for mums after having children, but also the experience that I had as a nurse in relation to how, fragmented the services are, particularly in women's health.
Amazing. So women's health and leadership are often treated as separate issues, but they are deeply connected. When women's health is overlooked, it directly affects career progression, workplace retention and leadership representation. So today we're looking to explore how we can break down these barriers and drive meaningful change. So that said, let's kick off with the first question for the panel is, why is it crucial to view women's health and leadership as interconnected, and what are the key changes we need to better support women in both spaces?
So I think I'm just going to take this one to begin with. As I've already referenced, we work quite reactively, especially in the NHS and in healthcare, and especially around women's health and leadership. So not only are we reacting to the situations that we have been exposed to, our parents, grandparents, and other people and generations before us, but when we look at women's health and how that is directly linked into leadership, we don't know enough about women's health. So if we're not investing in looking into women's health and looking at what the problems are and supporting women through these processes that sometimes take up to 20 years, how are we going to manage and support as leaders? How are we going to support and advocate for these women? So for myself and the teams that I'm working with, we are currently working alongside models using machine learning, robotic process, and risk stratification. So we're trying to implement this and look at how we can use this in a women's health space to look at what we need to do to support women's health, and then look at the impact that we've got on our leaders and on our workforces within the NHS to support this moving forward. It's by no means a quick fix, and it's going to be a long time before we see something there, but we need some evidence and real life situations in order to put this work into place.
Yeah, I think what you've said is really important, actually. And I think a lot of the technologies we see are very reactive and they're not preventative. And I think if we really understand specifically at what a mother needs, you know, what a female needs, whether they've got children or not, and understand, you know, what those metrics are to be able to then offer them personalised preventative support, not only is this a saving for the NHS, but also it's going to be giving those females exactly what they need at the right time before problems, you know, arise, which is what we're really passionate about with our technology.
I completely agree with what you've both said. And, you know, I'd like to take us back, you know, in history, in that systems have not been designed with the lens of a woman. And so actually what we've been doing since equality has come in is to readdress that balance. So if you look at women's health, for example, you can have a coil inserted without pain relief, but when you look at the procedures that men have, the first thing that they look at is pain relief. And so, you know, but if you look at who designed that pathway, it was designed by a man for a woman. And so for me, I think it's so important that we are sat at the decision-making tables, because once it's beyond the decision, all we're doing is influencing. And so I look at that in my role. So for example, in 2021, we were looking at wound management, and I looked at our training materials, and I didn't see myself represented. And I looked at the indicators, I couldn't see my indicators. Since then, we've shifted our policies, our practice, our risk assessments, and that is because we had representation that actually said, what you need to look at is someone who looks like me, and let's change the system to make that work. If you look at it, we weren't able to vote, we were not able to have credit cards. And so actually in 2025, we can now buy our own homes. We can now actually be called entrepreneurs. We're no longer called these agitators, people who are causing stress in the system. Actually, what we're being seen as are people who can take things forward. As the last panel said, you know, there is strength and there's quality in bringing diversity to the table, because actually we see things from a different lens.
Okay, since we've touched on innovation, and advocacy, what promising solutions are emerging to drive change in this space, and how can leaders, organisation and policy makers ensure the solutions actually create real impact?
Oh, sorry, do you want to go first? No, you go first.
Okay, I was going to go back to data. So a bit of a nerd when it comes to this, but we can implement so many things, but without speaking to the people that we're trying to support out there, we don't know if it's making a real difference. And we're not speaking to enough people, because there's a lot of stigma around talking about our problems. So whether it's around neurodiversity, whether it's around ethnicity, whether it's around the stages of our life, motherhood, anything that we're talking about, there's a lot of stigma. You think, if I speak up for this, I'm going to be labelled a troublemaker. I'm okay with that label. Stick another one on me, let's go. But what can I do with that label? Who can I support with that label, and what change can I make? So unless we implement something full force with authentic belief behind it, while still looking at whether it works in a real life situation, and then look at the data behind it, what are we doing? It's a tick box exercise. And all the time you've got to remember, not one size fits all. So it might be a great policy for today, but tomorrow's workforce might be different, have different requirements and different needs. And especially for women, we have to recognise that, myself, I've come from a family where it's, you have a family, you have children, you don't have a career, but, you know, you sit at home, you raise your children. Fantastic. My dad was like, you get out that door, don't walk back in until you've achieved what you want. Thanks for that, Dad. But it was that gave me the push, along with everybody spoke, like Kasim and Ed spoke about what pushed them into this space and their families. It was my grandparents, my granddad on both of my sides, my maternal and paternal, who were like, you show that you can make a change, because they have fought for women's rights in India, and they have fought for these things and these challenges. So if I'm not here today looking at representing the changes that they had tried to fight for, but didn't necessarily make a huge impact for. They made a change to one person and one person's life. So if we can recognise that the cycles of change are very individual, not one size fits all, and we've got to work with each other to support each other to find something that works, I think that's a really good starting point before we look at the data that we can gather in 12 months' time.
Yeah, and I think that what you've said is really important. But in terms of like, it's not just about, you know, the NHS and stuff like that. It's all around the companies, you know, because more and more women are returning back to work. And why shouldn't they, right? And actually, you said around data, I think as companies, they need to be surveying what they're doing well and what they're not doing so well. And, you know, we see a lot of returning back to work following sickness or maternity leave, but we know that the research is actually retaining those staff. And actually, the cost not only is to the woman, but it's also to businesses. You know, I've got here 20% cost of salary, you know, it is to replace somebody. So actually, and that's over £30,000. It could be even more if you're trying to replace a woman in a higher role. So it's really understanding that you're supporting that woman throughout their journey. You know, if they've got small children or they're going through the menopause. I think 1 in 4 women leave work because of symptoms of the menopause, and they don't feel that they are supported by their workforce, or they feel comfortable to even voice those concerns. And I think then again that comes down to how the company organises themselves. The change has to come from the top down, not from the bottom up. So those females feel empowered and not judged to speak up and ask for help.
I agree. Company culture is so important. In my organisation, you know, picking up on what you're saying around menopause, we now have a menopause policy, which means it gives you the language, it gives you the autonomy, and it gives you the terminology to be able to get a balance to working in an environment that suits you. We've also got a women's network, and that's a confidential space where you can come and bring your issues, and you can, as a group, work through how you're going to tackle that as an organisation. Because I think sometimes as one voice, it feels like you're fighting a war, but actually as many voices, it becomes a challenge. So it's how are we changing that? I think it's Zambia who've now introduced a policy where if you're on your period, you can actually have a day off. I was like, I'm moving there, you know. So progressive leadership, it starts from people having the empathy and the understanding. And so for me, it's how do we, so if we look right now and we look at our leadership, it's mostly men who sit at our exec boards. And so whilst we're on a journey to influence and change that representation, actually, how do we get them as allies? How do we get them on board to have that empathy, to understand that actually, if I have the best work environment, I'm actually going to do that much better in terms of my work results. And innovation looks different for different people. So, for example, if we look at flying, it's somehow, the seats have been designed for someone who's 5'6", size 10. But someone was like, innovation, we're going to bring extendable seat belts. So someone thought someone like me flying, to sit comfortably, I can have an extendable belt. And so I think for us, it's looking at the universe and looking at what's already been built and changing that construct. Because sometimes I think we're always waiting for someone to make that change. And actually, I think what I would say to people today is, when you look at your environment, and if it's not suiting you, how are you that voice for change in that environment? Because change starts with all of us, and we are the change we want to be. So I guess for me, it's starting to think, from today, how are we ensuring, we see the change we want to be?
Just to add again to what Kumbi said, menopause has become a big topic that's been very long waited for in the workplace. But I'd like to ask, how many people have seen within their women's networks, within their women's support groups, within their menopause cafes, as we call them, men attending? I think that's what we've got to encourage. Now, we've seen an increase from when they first started to today, so probably about 18 months since we've really been advertising, that we've got an increase of our male workforce, which again is majority of our corporate side, majority of the execs, a lot of the directors, now attending this because they have the awareness that this is a space that we need to be within to be able to support on the outside.
So I think we've kind of, for a lot of things that we've touched on is that women do make 50% of the population, but we also make a significant proportion of the NHS workforce. So we've got quite a loud voice there if we use it. So, but yet leadership policies and decisions don't reflect this, as we've kind of discussed just now. But how do we think we can strengthen allyship to ensure women's voices are heard and valued, particularly in leadership? But how can we also normalise conversation around women's health without the fear of stigma and bias?
I think it's going back to what I said previously. It's from the top down, you know, those females in those high positions, you know, talking authentically and open about their problems, so that actually it's, you know, no one's judged. You're creating a community in your workplace where women's voices are heard, you know, and it's not a weakness. And I think, you know, something with the NHS, everything's fragmented. I think there's lots of disconnect between lots of services. You know, it all needs to come together. It needs to be holistic. And, you know, why aren't we working to a framework, you know, in these companies? Why aren't we looking at what they're doing, where are the gaps, and what is it that we need to do to ensure that we're meeting a certain standard?
So I believe there is a top-down approach. So if we look at our government policies, so for example, in America, for maternity leave, actually there is zero allowance in terms of women having maternity leave, whereas in the UK, you can have up to 12 months. And more recently, it's been split where you can have 50% where you take it and your partner, husband takes the other 50%. And so policy, I think there is strength in that, because what you have is a legal framework that ensures that there's more fairness. But I also believe in our homes, we have, you know, in all our families, you know, or in your interactions, we are constantly interacting with men, and men who actually sit at these decision tables. So my question is, socially, are we having the conversation about the difficulties, particularly if we have men in our lives that actually have the ability to influence? Because sometimes some things addressed socially are better than when they're addressed in a work environment. And sometimes you might have politics, tension, and, you know, different agendas. So how are we thinking creatively to constantly have this dialogue? Because I think it's when we have dialogue that people see different perspectives, they have different understanding, and we have change that comes from that.
So I totally agree with what Kumbi and Terri have said. And I think that actually one of the biggest things that we talk about is training. And if you think about it, why should we have to train people to be empathetic? Why should we have to train people to be understanding? Why should we have to train people to see that we are all individuals and we all have different needs and requirements? However, our goals may be similar. So we may want to sit at this table. We may have these policies and these frameworks, which, like Kumbi said, that they're very much in place in a lot of organisations now. But trying to enforce one, to apply one, to fit within one, or ask your line manager to say, oh, I'm returning to work, I really want to look at flexible working, in itself is a challenge. So we can train, we can promote, but we have to really start with instilling that these are actual beliefs that our companies, our organisations, our teams support, believe and work within. And you know, Kumbi hit the nail on the head by saying we've got to look at the social dialogues that we're having. There are conversations that are seen not appropriate for a workplace. Sorry, but there isn't really many conversations that are inappropriate for a workplace, because we are all human. You know, we all have issues. We all have things that we're working towards and through. So there may be policies and frameworks behind us to support us now that weren't there 20 years ago. But actually, it's about getting to a place where you are comfortable enough to be able to discuss those and use those as your evidence base, or use those as your support in order to push forward what you require in the space that you're in.
No, amazing. So one of the things I wanted to pick up on is that we spoke about, obviously, women make up 50% of the population. We also spoke about data and how we make those changes. But one of the key things that I think we haven't touched on is that women aren't represented in that data. So when we're talking about AI or we're talking about chatbots and stuff like that, the research, because of our hormones, we are not necessarily represented in any of the actual data that's used to present some of the services that we then are asked to use. what do you think that we could do as a collective? And I'm not saying this necessarily as a healthcare sector, I'm saying us as women as a whole, to kind of break down and make sure that actually we are represented. So when we are buying services, we can feel assured that they actually meet our needs and understand us as individuals, not necessarily be sometimes imposed or seem to feel that, oh yeah, this is the research that's been done, but actually that research doesn't represent us at all.
We can all sign up to be participants within research. You know, it's something that we're allowed to do. Everybody can be a part of the research. You can begin research yourself. It's not something we have to wait for somebody else to do. But if you have to think about innovation and think about the way that we move forwards, actually you need to be encouraging, you need to be supportive, and you need to watch how particular people in the workplace may discuss and communicate what things are. So if you want to look at, I don't know, research around women's health in terms of diagnosis, you are trying to fight a stigma, trying to fight being put inside of a box because you've got a condition or you think you've got a condition or something already. And then are you going to be subjective to a journey of research as well? Are you then going to be given the space and time from work in your organisation and the understanding? So there's a lot of things, but a lot of it comes down to communication and building up those who want to be participants in research, but also spreading the word that we can all participate in this, and it's okay to do that. And if there's a stigma or we feel there's a stigma attached, let's break it. It's not there just to stick there and have a label. It's to say, okay, this was the way it is, but we recognise that the world is changing and we need to change with it.
I think it's collaboration between the NHS and also femtech companies, because I know in the Women's Health Strategy they outline that they want to now work more with femtech companies to collect data, which is then from a female that can then inform their interventions the other side. So I think that plays a huge part, because if we actually understand why the problems are, where they arise, not only can we be saving money, the NHS spend 1.5 billion on maternal health every year, yet the problem still exists. We can actually be more targeted in our approach, but also be understanding real life data that is actually from females. And that, I think the NHS are getting better as well at removing the red tape for those companies. As an owner of a femtech company, it's good to see that the NHS actually are recognising that they need now to be working with these other technologies to support and inform their decisions.
We need to shake up the culture. My mentor used to say, do first, ask for forgiveness later. Sometimes you've got to have that, advocacy approach. But also if I look at my organisation, so we apply the Equality Act 2010. As part of that act, you've got 9 protected characteristics, so gender and sex being 2 of them. So when we're looking at policies, we're looking at commissioning services, decommissioning services, people have to actually complete an equality impact assessment, which says by doing this, I do not believe that I will be disadvantaging a group. I know, for example, the NIHR, so the National Institute for Health Research, has also introduced these as part of their applications. So when you're now applying for £250,000 to do research, actually you now have to evidence how you're not disproportionately impacting people. As an organisation and as a city, we're now actually looking at data. Because actually, if we look at our census data, if we start to look at we've gone digital. So now some of our records are electronic. So we can very easily see in the east of the city, for example, where we've got late cancer diagnosis. So we can look at, so why is it that our residents in Birmingham are disproportionately impacted? Or if we look at our maternity services, we now know in terms of death. So, for example, Black women, 1 in 4 Black women die, by the time the baby's one year of age. So data is now helping us to ask those questions. Why are our services looking that way? Why are people getting the service that they're getting or the outcomes that they're getting? So I think there is an importance in data, but there's also an importance in actually looking at what is the legislation, what is the policy, And actually, who in my organization is responsible for this? Because there is a duty, there's accountability, there's responsibility. So how are we ensuring that the people that are employed are held accountable and responsible to ensure that our rights are being held?
Amazing. So I'm conscious that there's a lunch right after this. So to bring this to a bit of a close, I'm going to ask each of the panellists to, if you could give and leave the audience with one key takeaway to actually drive change and ensure women's health and leadership is not just supported, but truly fair and inclusive in one sentence, what would it be? And if I start with you, Mari-Carmen. Sorry, put you on the spot there.
I just think speak up, and speak up and fight for what you believe is right. Because I think if people aren't talking about their problems, then how can we make real change?
Yeah, very, very, very similar. Communication is key. If we don't say it, other people don't know it.
Let's continue to go on the journey. There've been women who've come before us who have led us to the freedoms we have now. And I want to be a woman that the next generation can look back at and say, yes, we're now better off because the change we made in this time.
No, thank you. So on that note, I'm going to end the discussion and thank you for taking the time to listen to us.
Thank you very much. Thank you, Reena, for channeling that, as you did mention.